Patient sought me out from Europe. We did a virtual consultation. Patient knows that I do plastic surgery and craniofacial surgery. That allows me the knowledge, skill set, and expertise to move the bony foundation of the facial bones and skull, to move the soft tissue of the face, the fat and the muscle. I have knowledge of the nerves and the anatomy. So this patient sought me out for those expertise. He wanted a very radical operation to be performed on his face. That operation I do perform. It's called orbital osteotomies, where we cut out the bones of the eye sockets, move the bones together. That can narrow the interpupillary distance on patients that have really wide set eyes. That operation shouldn't be taken lightly. That operation that I perform several times a year is an important one to consider, because the risks are you're operating around the eyeball and the eye socket, so blindness. The risks are you're operating right near the skull, which contains the brain, so brain injury. You could injure the sense of smell or the olfactory nerves that come through the nose as you're removing some of the ethmoid bone. The right operation for the right patient is often a satisfactory balance of risk to benefits. Trying to fit an operation for a patient that doesn't need it, and this gentleman I saw both with photos and virtually had within normal limits of facial proportions and facial thirds and interpupillary distance. While he felt like his eyes were somewhat widely spread apart, the risk far outweighed the benefit, and I had to turn him away. He understood. I just explained why and ways that we potentially could camouflage and do lesser invasive surgeries to try to improve his perception or his appearance. And he really appreciated that I talked him down from a very maximally invasive operation, which I'm confident with, but I only offer for select cases. He was nice enough to leave us a nice review regarding that, which I thought showed a lot of maturity on his part, that he appreciated our transparency, that I had the wherewithal to turn him away and give him some good options or good advice. And I think that that's the role of surgeon and physician, is one size doesn't fit all. I think a customized plan, personalized service, and really taking care of each and every patient as if they're family.